Okay, I guess that we're going to start. On va débuter maintenant. Mon nom est Robert Duguay. I'm Robert Duguay,
Recording
Director.
in progress.
I'm Robert Duguay, Director of Communication for Social Development. This afternoon, Minister Fitch will start by presenting a statement, and after that, he will take questions from the media. Alors, cet après-midi, le ministre Fitch va, durant ce scrum, va faire une courte déclaration, après quoi il prendra les questions des médias. We are limited to 30 minutes, so we'll do the best we can to take all the questions we have. So we hope you'll understand. Nous voulons vous mentionner que nous sommes limités à 30 minutes, alors on va essayer de nous assurer de pouvoir prendre toutes les questions que l'on peut prendre. So immediately, I ask the Minister to to proceed with the statement. Keep in mind that for the ones who are not familiar, at the bottom, you have a section called interpretation, so you can choose the language of your choice if you want. N'oubliez pas qu'au bas de l'écran, vous avez le choix de choisir la langue de votre choix dans la section interprétation. So at this point, we can proceed. Minister Fitch, with your statement. Following that, we'll take questions.
Thank you, Robert. Good afternoon, everyone. Bon matin, bon après-midi, tout le monde. Thank you very much for joining us here today. Merci de vous joindre à nous. I invited you here to provide a response to the report that was made public today by the Child, Youth, and Seniors Advocate. But first, before I proceed, I want to send my condolences to both the families and relations who went through this difficult time. You will appreciate that due to strict confidentiality regulations and legislation, I'm not in a position to speak about specific cases. Je ne peux pas parler de cas spécifiquement. La santé et la sécurité des personnes âgées est une priorité. It is a priority for the Department of Social Development to ensure that seniors are very well looked after in all our long-term care facilities. The situation depicted in this report is certainly troubling, and it is not something we are taking lightly. By that, I mean myself as Minister of Social Development, and also all the staff involved in long-term care services at the department. The report brings a perspective to a specific tragic situation and certainly brings attention to this matter. Now that we have received this report, we will review it carefully to see if any changes to our policies, procedures, and standards are required. Nous allons étudier ce report de détail. Social Development regularly reviews and updates as needed its policies and procedures to best reflect practices within the sector to make sure every New Brunswicker feels safe in the long-term care facility where they live. In New Brunswick, we have 540 long-term care facilities, all dedicated to providing the best services to about 12,000 residents. Now, the question that this report raises is the following. Are seniors safe in New Brunswick nursing homes? Est-ce que les résidents sont en sécurité? And I have no hesitation in stating today that we have full confidence in the commitment and ability of operators and staff to safeguard the well-being and safety of the 12,000 long-term care residents in our province. Nous avons confiance dans le service d'établissement au Nouveau-Brunswick. The incident described in the report is very, very serious. It's tragic and it is unfortunate. However, this incident is not evident of a systematic problem within our network of long-term care facilities. La situation n'est pas évidente d'un problème systématique. But as I stated earlier, we do not take such situations lightly at all. Again, unfortunately, I can't talk about specific cases, but I can assure New Brunswickers that any incident reported in a long-term care facility is investigated by the department without exemption. Tous les incidents sont sujets d'une enquête. And I want to remind any New Brunswickers who have concerns regarding the services provided by a long-term care facility that they should never hesitate to report these concerns to the Department of Social Development. Such a report will always be investigated. We believe in the capacity of our long-term care network to provide the best possible services to our seniors and our adults with disabilities. Nous avons des normes très élevées. We have strong standards in place to ensure the well-being and safety of residents. The Department of Social Development and the nursing homes make every effort to ensure that residents' needs are met within our system. All long-term care facilities are collaborative and responsive when issues arise related to the well-being and safety of residents. Nursing homes in particular follow best clinical practices in aiming to reduce aggressive behavior, including a person-centered approach by offering attention to individual residents to help relieve anxiety. Our standards include mandatory training that operators must provide to staff annually, including behavior management, prevention of abuse, and dementia care. Assessments and placements process contain measures to identify at-risk behaviors of residents and to share this information with those involved in the resident's case plan. For those individuals with more complex needs or issues, case consultations and plans are done collaboratively with other key departments, such as public safety or health, prior to the person's placement. Again, with the addition of this report's perspective, the department will continue to review its policies and procedures to make sure every New Brunswicker feels safe in the facility where they live. Over the past few years, we have established various initiatives to improve services and support to residents in long-term care facilities. Nous avons développé des initiatives pour améliorer les services et l'appui aux résidents. We have developed and updated the Adult Protection Investigative Guide, including related training and investigation checklists. A review of the Adult Protection Practice Standards is currently being done by the Adult Client Services Support Branch as well. The department is working on a digital transformation initiative in which incident reporting will be an important module. This tool will ensure a more efficient and effective way for the department to communicate with and provide resources to nursing homes. I also want to remind you about the changes that were made to the Nursing Home Act last fall to extend the notification period from 15 to 30 days, known as Bill 80. Changes to the general regulation under the legislation are intended to specify the circumstances under which the discharge of a resident from a nursing home may occur. And last year, we also announced an increase of the hours of care in nursing homes from 3.2 hours of care per resident last fall to 3.3 hours of care per resident next spring. As a result of these changes, staff in nursing homes, including registered nurses, licensed practical nurses, and resident assistants, will have more time to assist in the care of the residents. Le personnel pourra consacrer plus de temps et prendre soin des résidents. This is an important step to ensure high quality care and services to our seniors. I also want to thank the frontline staff and administration for their work during this last 2 years of COVID. And also families and staff have been strained. And certainly I want to continue to work together with staff and families of the residents to make sure that we get through COVID as well as possible. But I do appreciate all the patience and understanding of the families and the staff in the long-term care sector. That being said, my intention today is not to minimize this report or the situation as depicted in the report. I took the situation very, very seriously. Now it is our intention to review the report thoroughly and the recommendations attached to the report to make any changes to our policies, procedures, and standards that are required. for the benefit of the 12,000 individuals that receive services in one of our long-term care facilities here in the province of New Brunswick. Merci beaucoup. Thank you very much.
Thank you, Minister. Merci, Monsieur le Ministre. Alors, on va procéder à des questions des médias. Je vais les nommer selon la liste que j'ai ici des participants. Alors, we'll start with the question from the media. We'll ask each one. I will name your name by the list I got for all participants today. I'll start with Nathalie Sturgeon, if you have a question for the Minister.
Yes, I do. You said in your opening statement that people can be rest assured that any incident that is reported to the department is investigated, but this report specifically points out that an investigation that was done found no wrongdoing, but that they didn't do it properly and that it wasn't investigated thoroughly enough, and this death was entirely preventable. So how can New Brunswickers who are putting their family members in long-term care trust that the Department of Social Development will properly investigate these incidents and have their best interest at heart?
Thank you very much. Very good question. And as I mentioned, that part of the challenge I have here today is that due to confidentiality rules, I can't specifically talk about a particular case. But again, I can say that when we look at the investigations that are done, the reports that are made to us, to the department, we will again make sure that those investigations are done. Now, certainly part of the task that we have in hand here today is to take all the recommendation based on some of those, the report that was put out today is specific to inspections, and make sure again that there's anything that we need to change in our procedures in doing that will be done.
A follow-up question?
Yes, I do. In terms of those recommendations, obviously one of them is about mandatory staff training. We know that there are staffing crunches among healthcare workers, including in long-term care. So how realistic is it to get that training in there on time and sort of move that needle when it comes to staffing?
You're right. It is a difficult time right now, and we have all hands on deck trying to get through this fifth wave. And that's why it's a challenge right now with the number of outbreaks we have at the homes, the number of staff that are off, either sick or self-isolating. But we continue to make sure that the inspections are moving forward, and that, again, the residents in the homes are being protected. But COVID is making the whole continuum very difficult. And I think that's an understatement when we look at the healthcare system and long-term care together. But again, that's why I want to make sure that everyone knows that we're all working together. And I certainly appreciate the efforts that are being put forward by all parties involved.
Next, Ellison Simpson from CTV. Do you have a question?
Yes, good afternoon. I'm just wondering if you're looking at a timeline to implement any of these recommendations. I know this plays right off of what you just said about the difficulties with staffing, but do you have a time where you'd like to see at least some of these recommendations come into play?
Well, certainly some work has been done already when it talks about the standards and some of the education ideals going forward, that those have been looked at. And certainly the liaison officers, they reinforce the importance of that training and the directives and the standards. So we don't have a specific timeline to your question, but I know that there's always been ongoing. It's almost it's never static when we talk about standards and how to make sure best practices are being used in the homes. But specifically on a timeline on looking at these recommendations and implementing, we don't have specifics on that today.
Follow-up question?
Yes, which of the recommendations are going to be, I know you said you're working on some, but which ones will be the ones that are first seen throughout the next while, and which ones were most surprising that came as a recommendation?
Right, and that's a good question. I mean, there are 13 recommendations, and some of them are broken down into A to E. And part of what I wanted to do today is say, look, we are taking these recommendations seriously. We're receiving the report today, and we're going to be looking at each and every one. And again, when it comes to some of the items that we talked about already, we changed the act in the fall to extend the number of days where discharge would occur from 15 to 30. So already some of those, again, in the initial look, that some of those actions are taking place again to try and, again, make sure that the residents are protected in the homes.
Thank you. Prochain, Alexandre Boudreau, Acadie Nouvelle. Est-ce que tu as une question?
Oui, bonjour, Monsieur le ministre. Je comprends ce que vous avez dit par rapport au timeline, puis je comprends que le rapport vient d'être publié, mais Norman Bossé a mentionné que selon lui, il serait possible d'établir un système pour comptabiliser les événements de violence dans les foyers de soins en temps de 6 mois. Je veux savoir si vous vous engagez à respecter cet échéancier-là.
Merci beaucoup. Bonne question. Je veux dire, I'd like to say that, you know, part of receiving this report and putting timelines on them is a little premature. I know that there are some items that we have put forward with respect to some electronic reporting that may help and expedite some of that reporting. And I know I've been caught up in the past by putting a timeline on something and having it even self-imposed and not being able to meet that timeline for whatever reason. So it's certainly something that we look at, but one of the items when we talked about some of the electronic platforms that we're using to make that reporting easier might even make it a shorter time frame. So again, not wanting to put a time frame on it just because it sometimes is hit and miss, especially when you're doing looking at 6 months out.
Merci. Une seconde question, Alexandre?
Ça va, merci.
OK. Serge Bouchard.
Merci.
Est-ce que vous
Serge
m'entendez?
Bouchard? Oui.
Bonjour, Monsieur le ministre. Dans son rapport ou dans sa présentation média, M. Bossé a souhaité que ces 13 recommandations amènent des changements systémiques à la manière que les soins sont prodigués dans les foyers de soins. Vous avez dit que vous ne pensez pas ou que vous ne croyez pas qu'il y a un problème systémique dans le système ici là, des soins de santé. Alors, vous ne semblez pas partager la même opinion. J'aimerais vous entendre là-dessus.
Merci beaucoup. Bonne question. When I look at the long-term care sector and 12,000 residents presently residing there today, and that's 24/7, we've worked with some of the other departments like Department of Health, Public Safety, especially going through the COVID. But there's various partners that are involved in some initiatives such as our aging in place strategy, our provincial health plan, and one of the major pillars on the provincial health plan was the long-term care sector and the senior sector. So again, part of this report is looking at one situation and again, making sure that if there's recommendations that can come forward that can, again, make sure situations like this don't happen across the sector because it was a tragic situation. But I believe, and the experience I've had as an individual, as the minister, talking to and visiting the facilities, there was a high degree of care and providing service for the senior people in the province of Brunswick. So to say there's not improvements that we can make, certainly we continue to make sure we do the best practices to make sure people are safe and secure in the residence where they are.
As-tu une seconde question, Serge?
Non, ça va. Merci, Monsieur le ministre.
Okay.
Bien, mon plaisir.
Prochain sur la liste, next on the list, Savannah from Brunswick News. Savannah, it's your turn. Do you have a question?
Hi, yes. Can you hear me okay?
Yes.
Okay, great. So this morning we heard the advocate say that the department, I guess, failed to review this case beyond, the superficial. It took management responses at face value without much further investigation. There was an inability to carry out the review transparently or efficiently. I guess I'm just wondering if you can respond to those comments, not necessarily about this case, as I understand you can't do that, but about the review process in general. Do you think that's a fair assessment? And if not, maybe can you describe why?
And you're right, Savannah. I do have some challenges in speaking with specific cases, but I know that, again, every complaint that is made to the department with respect to adult neglect or abuse is inspected, and it's investigated. And again, it's investigated to a degree that, again, we should leave no question that that it was done thoroughly, and that has been my experience in the past. Again, part of having a report like this is to drill down into the recommendations, and again, make sure that that as we go forward, if there's best practices that need to be reviewed, or if there's a Long-Term Care Act, which again, we continue to review these acts to make sure that they're have the highest standards, and make sure that those standards are maintained across the spectrum. We'll certainly do that. So again, that's part of what we're doing here today, is making sure everyone knows we take these reports seriously, and we're taking the recommendations serious, and we will review each and every one of them.
A follow-up question, Savannah?
Yeah, thanks for that. You touched on some recommendations where you've said, changes have already been made. There's been some work done by the department. I guess I'm wondering which recommendations stand out to you maybe as ones that will require more work on part of the department that maybe haven't been touched yet, or maybe there hasn't been much work in past on it.
Sure, and of course, the ones that are most evident were the legislation we changed in the fall that again defended on the floors of the legislature, and along with that, we have a number of regulations that will be proclaimed probably in the not too distant future, because we had our 30-day public opportunity to quote on or to comment on the regulations associated with the discharge, changing it from 15 days to 30 days. And again, having some specific cause or specific reason, again, so that that some of the issues being addressed in the discharge of a patient can be addressed through the regulations and through the act. So that was a big one that has already changed. And again, some of that additional ones are the reporting of the quality indicators, making sure that, again, as we look at the long-term care legislation, which again, we continue to look at, that if there are some best practices that need to be reviewed, that again, we'll make sure that those are reviewed and, if necessary, changed.
All right, thank you.
Thank you.
Next on my list, Richard from CPAC. Richard, do you have a question? No question, I presume. So we'll go for the next one. Sharon Hudson, CBC. Do you have a question for the minister? Okay, next one on my list, Alan Deering, the Ben Moncton. I don't have a mic. Could this incident have been happened given a severe shortage of staff? I'm trying to see yeah, I'm reading again. I have your question here. So could this incident have been happened given a severe shortage of staff in homes, Minister?
Well, again, I can't talk to the specifics of this particular case, but again, that is part of the challenge in the overall sector, is making sure, and that's why we have enough staff throughout the sector, and a lot of that falls on the individuals' homes themselves is to manage that, but we set a high standard of what the staff ratio is, and in every review or inspection, those standards are reviewed. And again, if a home is below those standards, they do get written up for that. So again, looking at the global review of staffing, we've worked with the association again to try and help them with attracting and maintaining staff members. But the standard to make sure that the ratio is met is very, very strictly enforced right through the whole sector.
Any other question, Alan? Is the pay too low for staff? Could this be a factor, Minister?
Again, thank you very much. Great question. And we have worked with the association, of course, in the nursing home. There's labor negotiations as well. So there's two different sectors that we're looking at. And we did give a temporary bump in the salaries for some of the special care homes and adult care homes of $3 per hour for those under $18 an hour. And again, we have met with the association, done some work with them on trying to find out what the right salary is, what the right per diem is, and those discussions have been, very good, and gives each side the idea to know exactly what the numbers should be and where it is. But attraction and retention of staff is something right through the whole healthcare system, long-term care, and we even hear it in some of the private sector that, and that's why the government moved to increase the minimum wage next year by $2, $1 April 1 and $1 in October again, to try and get those wages up and put the money in the hands of the hardworking folks throughout the province.
Thank you. Next on my list, I have Marie-Emma Parenteau. Maintenant, Marie-Emma, est-ce que tu as une question pour le ministre?
Oui, juste une courte question. J'aimerais savoir, est-ce que le ministre peut me donner un exemple de la formation qui est demandée ou qui est donnée aux gens, aux travailleurs dans les foyers de soins concernant comment gérer des comportements à risque ou des comportements violents? Est-ce qu'il y a un nombre d'heures? Est-ce que c'est une qualification annuelle? Parlez-moi un peu de la formation qui est demandée.
Sure, and I'm not an expert in the clinic aspect of this, but the training that we've talked about is mandatory training, minimum of once a year, and then the staff trains their staff. And when it comes to trying to deal with patients with various needs, it's all different and it comes down to their case planner and how they're going to do that. But in general, I think I mentioned it in my speech, how some of the ideas of looking at an individual and using various methods of distraction or again, adult protection standards. And I was just looking forward as we head here, because I did mention it in my speech, some of the methods that they use in order to, again, reduce the aggressive behavior. I talked about the person-centered approach by offering attention to individual residents to help relieve anxiety. So again, there's various methods on that and in trying to do that, but the standards do include that mandatory training that operators must offer their staff annually, and that includes the behavior management, prevention of abuse, and dementia care.
Est-ce que tu as une question additionnelle? Marie?
Non, merci, ça va.
Merci. Okay, so that's
Merci.
all of the names I got on my list. C'est tous les noms que j'ai sur ma liste. Did I miss someone? Est-ce que j'ai manqué une personne qui aurait une question, s'il vous plaît? Est-ce que vous pourriez vous le signaler? Est-ce qu'il y a d'autres questions pour le ministre? Alors, je demande une dernière fois, est-ce qu'il y a d'autres questions pour le ministre avant que l'on conclue ce scrum? Okay. Ça va. Alors, Minister, I will leave you with the last words if you have closing remarks to make.
Encore une fois, once more, merci beaucoup tout le monde. Thank you everyone for your interest. This is a very interesting file, and receiving this report today is certainly an important step, and reviewing all the recommendations is something that we want to get to right away. And if, again, we want to say thank you to all the staff that's involved, frontline, and families dealing with COVID. I know it's not a difficult time, but working together, we'll get through this, and appreciate all the support that everyone has given our long-term sector over the last couple of years. Merci beaucoup tout le monde.
Thank you. Merci. C'est la fin de la conférence de presse. Thank you very much. It's the end of the meeting with the media. Thank you very much.
Merci.